In this video series, I'm going to cover a group of muscles that's referred to as the deep lateral rotators of the hip. Before I make a video covering each muscle in detail, I'm first doing an overview of the muscles as a group, and that's what this video is about. So the deep lateral rotators of the hip are also referred to as the deep six. And you'll see written, it's uncommon, but sometimes they're referred to as the short gluteal muscles. But again, that's pretty uncommon. I've only seen it written a few places. So we have the piriformis, superior gemellus, obturator internus, inferior gemellus, obturator externus, and quadratus femoris. These muscles all attach to the pelvis, and they all attach onto or around the greater trochanter of the femur. The reason I have a picture of the pelvis here is because when visualizing each of the lateral rotators, it's important to know what the pelvis looks like and kind of what the anatomy of it is. So before I start talking about the muscles, I'm first gonna give like a short anatomy lesson on the pelvis. So here's the pelvis. It's composed of two irregularly shaped bones. They're joined together at the back by the sacrum, which is part of the spine. So as you can see there, I've outlined the sacrum and the coccyx. The coccyx is also referred to as the tailbone, and it sits at the end of the sacrum. Another important feature here is the acetabulum, which is also known as the hip socket. So when the head of the femur fits inside this acetabulum or hip socket, that's what we refer to as the hip joint. This hip joint, the other term for it is the acetabulofemoral joint. Now, when talking about the pelvis, I think it's worth mentioning that there's different names for the bones of the pelvis. And so, because it can kind of get confusing, at least it was for me when I was first learning about this, I'll just go over some of the names of the pelvic bones. So if you were just wanting to refer to one of the bones of the pelvis, you could call it the hip bone, or os cocci, or the pelvic bone, or the coxal bone. So those would all be legitimate names for this structure. So using our first slide, I'll delineate the three main areas of a pelvic bone. It's important to know these areas because when you know them, you're more able to visualize muscles that attach to the pelvic bone. So the first area I'll talk about is the ilium. It's the uppermost part of the pelvis. So when someone puts their hand on their hip, what they're doing is they're actually putting their hand on the ilium of the pelvic bone, or the hip bone. And specifically, they're putting it on the iliac crest, which is at the top of the ilium. The next part is the pubis. It's the most anterior part of a pelvic bone, and posterior to the pubis is the ischium. This is a lateral view of a pelvic bone. So the view is as if you're looking at someone at the side of someone, and you're looking directly at the hip socket or acetabulum. And as you can see, the ischium, ilium, and pubis, they all converge in the hip socket or acetabulum, and they make up part of it. Something that's also worth noting here is that the ischial tuberosity, which is at the bottom of the ischium, that's also what's known as the sit bones. Something that's also good to know is that these bones, or these areas that make up the pelvic bone, so the ilium, the pubis, and the ischium, they're actually separate bones throughout much of childhood, and they don't fuse together completely until sometime in adolescence. Another important feature of the pelvis is called the obturator foramen. So it's a hole that's formed by the pubis and the ischium. So I'm about to talk about muscle attachments for the various deep lateral rotators of the hip. But before I talk about muscle attachments, it's important to know which surfaces of a pelvic bone are external surfaces and which surfaces are internal surfaces. So if you look at the pelvis here, you can see it's kind of bucket shaped. So it gets a little complicated though, because it's not exactly like a bucket, because you have the obturator foramen at the bottom, which makes it kind of complicated. So a way that makes it easier for the brain to visualize this bone is to learn about the internal surfaces of it and the external surfaces. And it sounds complicated right now, but it actually makes understanding this bone much easier. So this is a view of the pelvis that is anterior. So it's as if you're facing the person head on. The ilium, from this perspective, is the internal surface of the ilium. This is the external surface of the pubis. And that is the external surface of the ischium. So this is a posterior view of the pelvis. That means you're looking at it as if you're looking at a person whose back is turned to you. The ilium, from the posterior view, that is the external surface of it. This is the internal surface of the pubis and the internal surface of the ischium. Now I'm going to talk about muscle attachments for the deep lateral rotators of the hip. The first ones I'll talk about are obturator internus and obturator externus. I'm picking these two to talk about first because we've just talked about the obturator foramen of the pelvis, and we've also talked about the external and internal surfaces of the pelvis. If you look at the name obturator internus and obturator externus, they're both referring to these aspects or concepts. So they're one is on the internal surface of the pelvis, and another is on the external surface of the pelvis, and they're both surrounding the obturator foramen of the pelvis. So I'll start with obturator internus. So as you may remember, when you're looking at the pelvis from a posterior perspective, you're looking at the internal surface of the pubis and the ischium. So I've drawn in the obturator internus here. So from what you're seeing here, you could say the obturator internus originates from the internal surface of the obturator foramen of the pelvis. So this is an anterior view of the pelvis. You may recall that when you look at the pelvis from an anterior perspective, you're looking at the external surfaces of the pubis and the ischium. So I've drawn the external obturator muscle in here. So it's originating from the external surface of the obturator foramen. As it travels to the femur, it wraps around it posteriorly. And it doesn't attach directly to the greater trochanter. It attaches to the trochanteric fossa of the femur. When you're looking at the pelvis from a posterior perspective, you wouldn't see the obturator externus with the other external rotators of the hip because it is deep to the quadratus femoris. So we've talked about the attachments for the obturator internus and the obturator externus. So that leaves us with 4 more deep lateral rotator muscles to go through. We have the piriformis, the superior gemellus, the inferior gemellus, and quadratus femoris. Piriformis originates from the anterior lateral border of the sacrum, and it travels to the superior aspect of the greater trochanter. The superior gemellus originates from what's called the spine of the ischium, and it attaches to the greater trochanter of the femur. The inferior gemellus originates from the superior aspect of the ischial tuberosity, and we've talked about before the ischial tuberosity is known as the sit bones, and it attaches to the greater trochanter of the femur. This is quadratus femoris. It's the last lateral rotator muscle that we'll talk about in terms of attachments, and it originates from the ischial tuberosity, or the sit bones. And you can see it's called quadratus because it kind of has more of a square shape. And it inserts onto the intertrochanteric crest of the femur. So I wanted to use this image to review the attachments that we've gone over. You can see the piriformis here. It's originating from the anterior surface of the sacrum, and it's attaching to the superior aspect of the greater trochanter of the femur. You can also see the obturator internus. It's originating from the internal surface of the obturator foramen, and it's traveling to attach onto the greater trochanter. Obturator internus is sandwiched between the superior gemellus and the inferior gemellus. And it's good to know that the 3 muscles, the obturator internus, superior and inferior gemellus, they often converge into one tendon at their lateral attachment. At the bottom, you can see the quadratus femoris. It's originating from the ischial tuberosity, or the sit bones, and it's inserting onto the intertrochanteric crest of the femur. The muscle that you can't see from a posterior view would be the obturator externus. It's behind the quadratus femoris. So now I'm going to go over some biomechanical considerations and treatment considerations for the deep lateral rotators. So it's in their name, they laterally rotate the thigh at the hip joint. Another function is that they prevent or control medial rotation of the thigh at the hip joint. This is important when walking or running, and in other activities that involve medial rotation of the thigh. Some orthopedic conditions where this is relevant are overpronation of the foot, or pes planus. Now, pes planus is where the arch of the foot has collapsed, and it's more commonly known as flat feet. So in both of these conditions, overpronation of the foot and pes planus, there's going to be usually excessive medial rotation of the thigh, and the lateral rotators might be pulled taut, or they might be working extra hard to resist that excessive medial rotation. When the femur is fixed, The deep lateral rotators will create contralateral rotation of the pelvis. This reverse action of contralateral rotation of the pelvis is important when walking, running, or planting the foot to change direction. Another important function of the deep lateral rotators is to stabilize the hip joint. It does this by pulling the head of the femur into the acetabulum or hip socket. Some other information that's good to know about the deep lateral rotators are that piriformis and quadratus femoris are the largest deep lateral rotator muscles. Piriformis and obturator internus are the only deep lateral rotators to originate from the internal surface of the pelvis. The other four deep lateral rotator muscles originate from the external surface of the pelvis. Gluteus maximus can also laterally rotate the thigh at the hip joint, but it's located superficial to the deep lateral rotators. Gluteus medius is actually located at the same depth as the lateral rotators, the deep lateral rotators. And its posterior fibers can laterally rotate the thigh at the hip joint as well. Gluteus minimus is located deep to gluteus medius, and its posterior fibers can also laterally rotate the thigh at the hip joint. I'll end this video by talking about innervation of the deep lateral rotators of the hip. If you don't know what the lumbosacral plexus is, it's a network of nerves that are coming off the spinal cord in the region of the lower back. So when these nerves come off the spine, they converge and mix their fibers together, and then they separate, and then they converge again. So the word plexus means braided, so you can kind of see why that word was chosen for the name. The lumbosacral plexus is responsible for creating major nerves of the lower body. So it creates the obturator nerve, the femoral nerve, and the sciatic nerve. It also creates smaller nerves, such as the nerve de piriformis. So if you were going to describe the innervation of the piriformis muscle, you would say it's innervated by the nerve de piriformis from the lumbosacral plexus. So the majority of muscles in the deep lateral rotator group are supplied by these smaller nerves that are coming off the lumbosacral plexus. The only exception is the obturator externus. The obturator externus is innervated by a major nerve of the lower body, and that is the obturator nerve. So in my next video, I'll go into more detail about one of the deep lateral rotator muscles of the hip. So I'll start with piriformis, and I'll talk about its attachments, innervation, actions, resistance testing, how to strengthen it, how to palpate it, how to stretch it, and other treatment considerations.